Dental Fuel, the podcast that focuses on what no one else is talking about: mistakes. The dental world is full of before and afters, and no one is talking about the middle. Dental Fuel brings you the unspoken in between. Welcome back to another episode of Dental Fuel. Dental Fuel is brought to you by 90 Day Jumpstart, a program to help you increase production and break free from financial stress. We are back with Dr. Dar Radfar. In this episode, Dr. Radfar sheds light on financial mistakes young dentists should avoid and the importance of continuing education and the benefits of mentorship in shaping a successful practice. Dr. Radfar also talks about some financial pitfalls that dentists face while investing in expensive equipment and not being ready to take the next step in their business. Let's tune in. As you were taking, some of these courses and building your practice and bringing in, sleep more into your practice, were there any financial mistakes that you found yourself making while you were trying to grow your practice?
Yeah, a lot of courses teach you to purchase equipment, right? And the equipment to purchase sometimes is not necessary to do the trait that you need to do. Of course, when you're placing implants, you need the proper instrumentation to place implants. But do you right away need a CT scan? Maybe not, because you don't know if you're going to be doing this and you're comfortable in doing this consistently. So what I would always recommend to people is first try to get into it. Don't purchase the $80,000, $100,000 equipment that's associated with the trade that you just learned, unless it's a necessity to do the trade. And then you can add so you don't lose out on money. I got offered a skin treatment for patients that dentists can do to help with like the wrinkle lines and and whatnot. And dentists can do that in the state of California. And I bought the machine because it looked good and all that. And it was $124,000 for the machine. And I was super excited to use it. Now I maybe use it once or twice a month because it's just not something I feel comfortable in quote unquote selling or presenting to the patient, because it doesn't really have much to do with dentistry. It does have to do with the cosmetics of the face, but it doesn't have anything to do with dentistry. So make sure before you purchase any expensive equipment, it's something of a procedure that you're really comfortable in presenting and doing before you make that investment.
Do you still use that machine at all, or is it collecting dust somewhere?
It's still in the office. I probably used it twice in the last month, and that's not enough for what it cost to get it. So it's there. I've got posters about it in the front of in the lobby area. But most people are psychologically coming into the dentist for the mouth and head, and not necessarily wrinkles and acne scars and whatnot. And there's some dental offices that do succeed in it. It's not something I'm fully believing in. That's why it's kind of a waste of equipment at this point.
Sure. You mentioned earlier the importance of taking continuing education courses, and it can be challenging to, get your finances in order to allow yourself to go out and take these courses. What would your message be to maybe younger dentists or middle of the road dentists who want to take more courses, but they really can't find the time and the finances in order for them to do that?
If you don't have the time or the money, then you need to still do the bread and butter stuff that you've learned. One of the first things I learned how to do was Invisalign, because it's clear orthodontics seems to be a very popular thing that you should add as a part of your practice. That didn't cost much for me to make it happen. I think the course fee was like $1,200 for the whole weekend. And it was something that right away I felt comfortable in doing. And maybe finding a mentor really does work. If you're an associate, finding a job. I had 13 different locations that I worked at before I bought my own office. Some of them were just for the day, because some of the stuff I saw in there made me feel uncomfortable to work as a dentist. But a lot of them were, wow, this guy does a lot of implants, or this gal does a lot of Invisalign. So it was like, I didn't care relatively how much the money was for my minimum guarantee when I was working. It had to be respectful, and that was My main reason was I'm going to go work there for at least a few months because it was free training and I'm
Mm-hmm.
getting paid as an associate to understand how to do more Invisalign because this doctor is really more well versed in Invisalign. So I'm sure there's private offices and of course some DSOs that cater to a little bit more procedures. And as a dentist, if you're doing this early and you're still as an associate, I would recommend you find a job. I had sometimes in 1 week 3 different offices just because one of them specifically wasn't about me making any sort of a living from it. Although I
Mm-hmm.
got paid, it was specifically to learn more because this guy was really good at implants and he showed me a lot of things after I took my own course.
That's very cool. So you were kind of were you like moonlighting at these different practices, or you were just going in for a working interview and staying there a little bit longer?
Yeah, if it was a working interview, I would, I'd ask them what procedures they do more of over there. It would sometimes it would be for maternity leave. I'd be there for 3 months helping the practice, or someone was hurt as a dentist and I would be, helping them out and, or their associate got hurt for 8 weeks. So a lot of these offices were just go in, see how it is. And if I liked it, I stayed. It was one of the jobs I
Mm-hmm.
was at for 3 years, and he was a big time mentor for me in the way he cut his crown. I mean, I do a crown in about 7 to 10 minutes max. I could do 20 preps in less than 50 minutes, and that he taught me things I didn't learn in dental school, like using a big football burr and getting a reduction, buccal, lingual, occlusal, all these little things that I didn't get at USC taught me a little bit more of a step-by-step fashion that would take longer. My
Mm-hmm.
speed improved, which is more valuable and priceless, I think, than any procedure that you add. So you got to feel comfortable associating at some of these offices
Mm-hmm.
that you're interested. Like I've had my associate right now is really interested in sleep apnea. She's never done sleep before. And she's like, wow, this is a big game changer in people's lives. And she's been out for almost 4.5, 5 years now. So,
Mm-hmm.
and so I'm teaching her. So, finding a good office that you can learn from is free education.
Mm-hmm. I think it's so nice to be mentored, but also to serve as a mentor to others. I think that is just kind of a full circle moment for dentists as they move on through their career. From a from a financial stability point, would you recommend newer dentists to go that route and maybe try different associateships out before they make a decision as to what's best for them?
Yeah, some people are just uncomfortable having their own offices. I truly believe that after 2 or 3 years of working 4 or 5 days a week, you should jump in and dive into
Mm-hmm.
having some sort of a practice of your own. So, you know, right now associates can make some really good money, but you got to have
Mm-hmm.
tools in your toolbox, right? You got to be trained to do implants. You got to know how to do clear orthodontics. You got to know how to do sleep apnea. All these things increase your production collections numbers, and then if you're getting paid on a percentage and a base pay or a percentage, which is what I used to get paid, which is very much more
Yeah.
incentivized. So yeah, I mean, it's not about the money the first couple of years. I know we all have student loans and some of that we wanted to have the lifestyle already. It's more about adding tools in your toolbox, putting those extra things on the menu so that when you're as an associate, you'll be more valuable, let alone when you open up your own shop.
How did you transition from going to different roles and different positions into starting your own practice and building that?
Oh, I was very thirsty to having my own office. One of the major reasons was the tax write-offs and the benefits
Sure.
of having your own business, right? And so, for me, it was more just paying attention to the private offices that I've worked for some of the bigger corporations as well as an associate, but it was paying attention to what my mentor did for me, Dr. Dumanian, when I was with him for 3 years. Just seeing how he runs payroll, what he uses for payroll. When someone wants a raise, just communication and having that open line of communication so that he can share his trials and tribulations of the negative things that are happening and what happens when this hygienist didn't show up and what he does. So I kind of, literally learned from him. That's why it's really crucial to be set up with someone that you can actually learn
Mhm.
from, not just work for.
Yeah, mitigating those challenges in a dental office is hard. You don't learn that in school or before that unless you're in a similar setting. But that's just something that having a mentor or shadowing somebody who has good management skills can really help you in the long run. We hope you're enjoying our conversation with Dr. Dar Radfar. Be sure to tune in next week where we talk about a team mistake. If you're looking to grow your practice and need some help along the way, be sure to check out 90-Day Jumpstart. You can start for free by contacting Dr. David Rice. Check out the link to his Calendly in the show notes.